So we're going to be presenting on congestive heart failure. It's a condition in which the heart is unable to pump sufficient blood to supply the body's needs. Heart failure is not a disease, but it represents a group of clinical manifestations caused by inadequate pump performance. And this is either the cardiac valves or the myocardium. So this can be a chronic condition over many years, or it can be acute and life-threatening. So there's two main parts to CHF. There's the systolic heart failure, in which it cannot pump hard enough, and then there's diastolic heart failure, in which it cannot fill enough, and these both lead to blood in the lungs, which causes congestion and fluid buildup.
So here we got some signs and symptoms of CHF. Symptoms can be systemic, peripheral, in the cardiac region or in the pulmonary region. A couple of them can be seen in both, such as tachycardia or dyspnea. But some common ones for left-sided heart failure are fatigue, syncope, mitral regurgitation, orthopnea. And some common ones for right-sided heart failure would be hepatomegaly, hepatic tenderness, Cosimoll's sign, pitting edema, elevated JVP, stuff like that. And we also have some etiologic and risk factors. So just list a couple off here you guys can read, but some etiologic factors would be hypertension, coronary artery disease, or a myocardial infarction. And some risk factors would be emotional stress, physical inactivity, obesity, and diabetes mellitus.
So congestive heart failure can happen left-sided, right-sided, or both. So we're going to break it down and tell you what happens when a right-sided one or a left-sided CHF happens. So in the left side, we're going to see the left ventricle that will weaken, which will also decrease the cardiac output. You're going to have decreased renal blood flow, which will stimulate that renin-angiotensin and the aldosterone secretion. With this, you will see a backup of blood into the pulmonary vein, which will cause the high pressure in the pulmonary capillaries, which will eventually lead to pulmonary edema or congestion in the lung. So since this is in the pulmonary side, we could see pulmonary edema with the left-sided CHF. And then we move over to the right-sided, we're going to see that the right ventricle will weaken, and so that's the side where it empties. So in this case, it won't be able to empty as efficiently, which will cause a decrease of cardiac output. You'll also see a decrease in renal blood flow, which will stimulate the renin-angiotensin and the aldosterone secretion. You'll also see backup of blood flow, but this time it's going to be more systemically. So then you'll have an increase of venous pressure that will result in edema in the legs, liver, and the abdominal organs instead of the lungs, since it's more systemic in the right side. And then you're also going to see very high venous pressure that will cause a distended neck vein and cerebral edema. So a disorder that is commonly seen is lymphedema.
So the incidence of CHF, it's pretty common with other heart disorders or complications. Congestive heart failure affects people of all ages, and the incidence is equal in men and women, but a little bit higher in African Americans than Caucasians. Heart failure is responsible for 11 million physician visits each year, and it also contributes to approximately 287,000 deaths per year in the U.S., and is also a global pandemic affecting at least 26 million people worldwide.
So why should this be included in the top 20? Congestive heart failure can be the result of damage or pathologies in the cardiovascular system. It can lead to damage of other systems, such as the kidney damage, heart valve problems, heart rhythm problems, or liver damage. It can also occur because of other issues. So it can occur following an MI because there's damage to the pump. It can lead to respiratory problems because there's fluid buildup into the lungs, and this is specifically with left-sided failure. And it can also cause a decreased renal flow, which stimulates the angiotensin aldosterone secretion, and this is because of a lack of blood perfusion and increased blood pressure.
Thanks.